Two topics, please, Professor Khunti. First of all, I'm going to cite, I'm not going to go to the INQ number, but it's INQ 000280061, which is part of Sir Patrick Valance's diaries. At page 205, Professor Khunti, he recorded an entry on the 6th of October 2020, listing the reasons why the Great Barrington proposal, namely herd immunity and let it rip, as you'll be aware, is wrong. Number 4 on that list was long COVID. First question, do you agree with Patrick Valance's view that long COVID was one of the reasons why letting the virus spread unchecked was wrong?
Absolutely. I agree with that. As I mentioned earlier, at the moment, the way to reduce the risk of long COVID is through reducing the risk of people getting COVID. And this is through, as we said, all the NPIs. And now we have the vaccines that can drive the risk. Vaccines drive the risk, reduces the risk, and there's good evidence now that if people are vaccinated, they're less likely to get long COVID. If they have long COVID and they're vaccinated, there's also data to suggest that they get less long COVID.
Thank you. Since you've said yes, can you answer this subsidiary question? Should long COVID be one of the factors to take into account in assessing the need for non-pharmaceutical interventions to limit transmission?
Yes, absolutely. As I've said, that's one of the ways, and one of the major ways of reducing the risk of getting COVID in the first place. And we also know that if you have had COVID and you have long COVID and you have COVID again, your risks are worse. So definitely, yes.
Thank you. And would SAGE be responsible for informing government decision makers about the nature of risk of long COVID, as with other factors on Patrick Valance's list, such as how long immunity lasts?
I think that was already in many of the SAGE papers. The SPI-M modelling had looked at how long the immunity lasts after an infection or vaccinations, and these were all taken into account when the modelling was done.
Thank you. You said at paragraph 3.5 of page 13 of your report, you said by August 2020, understanding was sufficient for guidance on management of post-acute COVID, as the longer-term effects of COVID-19 were termed, to be published in the British Medical Journal. Is it right that SAGE did not provide advice on long COVID to government decision makers by October 2020, when Sir Patrick Vallance made this note in his diary?
As I mentioned earlier on, there weren't any interventions for people with long COVID. And indeed, you'll hear on Friday, we don't have any interventions at the moment. We're really at its infancy in terms of knowing much about long COVID. So at that stage, we did not have any interventions to put into place to help people with long COVID, except to reduce the risk of long COVID with the interventions I mentioned, the NPIs and the vaccination programs.
All right. Well, that ties in well to my second topic that I want to go on to, on recommendations. The long COVID group, the two questions I want to ask you about that in relation to something you've said, I think, both in evidence and paragraph 3.8 of your witness statement. Can we, you of course sat on SAGE, can we look at the minutes of SAGE 94 on the 22nd of July 2021, which is INQ 000092856? I don't know if that's going to be put up.
It's up.
Oh, sorry, I'm not on my screen. Sorry. Could we go to, please, page 4, paragraph 27? I want to ask you about the fourth line, which starts, for those children who do suffer long illness.
You need to be near the microphone. Sorry.
Oh, I'm sorry. Yes. It's on my screen. It's on my screen, thank you. For those children who do suffer long illness duration, there may be a need for guidance to parents, carers and schools on how to support them. Would you agree that this appears to be a recommendation from SAGE?
That's what it seems like, yes.
Thank you. And do you know if that guidance was prepared?
I'm not aware of that, sorry.
So you're not able to say if it wasn't, why it wasn't?
As I said, I was on the stage as a chair of the ethnicity subgroup. I did give comments on long COVID, particularly for the CIS survey. Children's long COVID is not my area of expertise.
So be it. And the last INQ I'd like to take you to 000249-018, which is a WHO policy brief, number 39. That's titled, "In the Wake of the Pandemic, Preparing for Long COVID." Can we look at, first of all, the first page and just confirm that you're a co-author?
That's right, yes.
Thank you. Page 4, can we go to, please, which is a correction from the 22nd of March 2021. Can we take that to indicate that the report was published by then, March 2021?
This is the first time I've seen this, so if this is there, yes, I do agree.
So you do agree that we can indicate the report must have been published by then, March 2021?
Yes.
Thank you. And the last thing I want to ask you, page 23, please. We can see there a number of recommendations for policymakers. Do you have that, Professor Khunti?
Yes.
Yes. Do you agree